Prostate cancer is the second most commonly diagnosed cancer in men worldwide and the most common cancer among men in many African countries, including Nigeria. Every year, hundreds of thousands of men are diagnosed, and tragically, many find out at an advanced stage. However, prostate cancer, when detected early, is one of the most treatable cancers. Many men, after being diagnosed, go on to live healthy, full lives. Welcome to another episode of Doc Series, and in this video, I'll be talking about what the prostate is, what prostate cancer is, how it can be detected, and the signs and treatment options. Before we talk about prostate cancer, it is important to know what the prostate gland is. The prostate gland is a walnut-shaped organ which is part of the male reproductive system. It sits below the bladder, in front of the rectum, and surrounding the urethra, which is the tube that connects semen and urine out of the body. Now, the prostate gland functions in the reproductive system in that it provides the prostatic fluid, which nourishes the sperm cells. The prostate also plays an important role in the flow of urine, as any enlargement in the prostate affects the urethra and affects urine flow. It is important to note that the prostate gets larger as men get older. This benign enlargement is known as benign prostatic hyperplasia, and it is not cancer. It is, however, very common, and the symptoms with cancer overlap, which is why medical evaluation is so important. Now, what is prostate cancer? Prostate cancer occurs when the cells in the prostate begin to enlarge and divide abnormally, forming a tumor. Prostate cancer is unique in its behavior in that many are slow-growing and may never cause symptoms or affect one's life, whereas others are quite aggressive and rapidly growing and spread to other parts of the body. This dual nature of prostate cancer makes it both fascinating and challenging in that being able to distinguish between the slow-growing tumor and the fast aggressive one is very critical to its management. Race and ethnicity also play a role, with men of African descent having the highest rate of prostate cancers in the world. The reason is not yet fully understood, but it's thought to likely be a combination of biological, sociological, and economic factors. Family history is another important factor, with history of a first-degree relative having prostate cancer, that is, a father or a brother. Risk of prostate cancer increases to 2 to 3 times higher than the average man. Genetic mutations also play a role. Men with mutations in the BRCA1 and BRCA2 gene, which are associated with breast and ovarian cancer in women, are likely to have aggressive forms of prostate cancer as compared to others. Diet and lifestyle factors also contribute. Diets high in red meat and high-fat dairy products are associated with a higher risk of prostate cancer as compared to diets rich in vegetables and tomatoes, which has been shown to have a lower risk. Obesity is also indicated in the risk factors of prostate cancer, with abdominal obesity also noticed to have increased the risk. Now, for the signs and symptoms, one of the most dangerous aspects of prostate cancer is that in its early stages, it presents with no symptoms at all. At this point, the tumor is confined to the prostate and the man might feel completely well with no issues whatsoever. Now, as the cancer develops and grows, the prostate begins to compress on the urethra and it might manifest as urinary symptoms, such as frequent urination, urinating frequently at night, hesitancy, which is difficulty in urinating, having to strain where you urinate, a weak stream of your urination, or blood in the urine or semen. It is important to note that these urinary symptoms are also common in benign prostatic hyperplasia, BPH, which is non-cancerous. Symptoms alone cannot distinguish between BPH and cancer, which is why medical evaluation is very important. In more advanced stages, when the prostate has spread to other organs, it may present with symptoms such as deep and persistent bone pain, particularly in the back, hips, and pelvis. It can also present as persistent fatigue, unexplained weight loss, swelling in the lower limbs, or erectile dysfunction, which is why any of the symptoms noticed in a man over 50 should present to a doctor promptly. Early detection is the single most important factor in improving outcomes for prostate cancer. There are 2 tools used for this. First is the PSA, which is a prostate-specific antigen. This is a protein that is produced by normal prostate cells as well as cancerous prostate cells. An elevated value of this gives us a clue to go in to look for prostate cancer. However, this can also be elevated in other conditions such as BPH. It can be elevated after normal physical activity. It can also be elevated in conditions of prostate inflammation called prostatitis, and it can be elevated after sexual activity. Despite all of this, the prostate-specific antigen is still the preferred test for screening for prostate cancer, as mortality rates in prostate cancer have dropped by 70% since the use of it. The second tool is the digital rectal examination, where a medical professional uses a gloved, lubricated finger to examine the prostate gland for changes in its size and texture. A combination of these tests is, however, preferred to detect for prostate cancer before going on to further invasive tests for confirmation, such as biopsy. The prostate biopsy is the most definitive test for the diagnosis of prostate cancer. This procedure involves taking a small needle to take sample from the prostate gland. The sample taken is then viewed under a microscope for aggressive changes to see the nature of the cancer. These changes are then graded against something called the Gleason score to determine the nature of aggressiveness of the cancer. Additional tests such as CT, MRI, and bone density scans are also done to know the level of infiltration of the cancer and the level to which the spread has gone. Prostate cancer staging is done according to the level of spread, with staging being from stage 1 to stage 4. Stage 1 of prostate cancer is when it is still confined to the prostate, but however is not detectable on DRE and the PSA is still very low. Stage 2 is still confined to the prostate, but now the prostate is larger and symptoms might be start to become apparent. Stage 3 of prostate cancer is when it has spread to surrounding structures such as the seminal vesicles and the bladder. Stage 4 is when there is distant spread to other organs such as the lymph nodes, the bones, the liver, and the lungs. Stage 4 is not curable, but with proper management, it can be palliative. Prostate cancer treatment has evolved dramatically over the last 2 decades and offers men a wide range of options. The right treatment depends on the stage and the grade of the cancer, the patient's age, overall health status, and the patient's preferences. For slow-growing cancers, active surveillance is the mode of treatment chosen. This is done where the doctor monitors the cancer with repeat PSAs, repeat DREs, and repeat biopsies. This avoids exposing the patient to treatment which might cause side effects for them, and treatment is only initiated if the cancer starts to show signs of progression. Active treatment involves 1. Surgery, which involves the removal of the prostate and surrounding tissue. Other options include radiation therapy, hormonal therapy, chemotherapy, immunization therapy, immunotherapy, and targeted therapy. One or more of these treatment options can be used depending on the stage and grade of the cancer, as well as the patient's age, health preferences, and health status, like I mentioned. A prostate cancer diagnosis can be life-changing, emotionally, physically, and practically. But many men go on to live for years, even decades after a diagnosis, especially those who were detected at an early stage. The side effects of treatment, which include urinary incontinence, fatigue, weight loss, erectile dysfunction, and hormonal changes, can significantly affect the quality of life. This should be discussed openly with the healthcare team, as many management strategies are available. Lifestyle modifications play an important role in recovery and long-term health. Regular physical activity has been shown to improve mood, reduce fatigue, boost cardiovascular health for men on hormonal therapy, and has even been shown to help in the reduction of recurrence of prostatic cancer. A diet rich in vegetables, whole grains, and healthy fats has also been shown to support overall well-being. So while there is no guaranteed way to prevent prostatic cancer, there are evidence-based steps men can take to reduce the risk and support overall prostatic health. These include maintaining a healthy weight, eating a prostate-friendly diet, knowing your family history, and regular screening once you get to the age of 45. So, if you're a man over 45, or you have a brother, a husband, or a father who is over the age of 45, share this video with them. Book that screening appointment today. Have that conversation with your doctor. Your health is worth it. If this video was helpful, please like, share, subscribe for more health education content. Thank you.